Yeah. Hello. Welcome in. They call me Sour, and today we are watching The Pit, Season 2, Episode 8. Last episode was so much fun. We got Dr. Abbott back, easily one of my favorite characters, and not just because he is incredibly attractive. We had tons of fun little moments with Robby, and by fun, I don't necessarily mean lighthearted. Like, we had that moment with Santos where they talked about Whitaker, and the way they talked about Whitaker was so important to me in that they really are a family right now. And it's really important that they take care of each other. We had that. But then we also had, well, the moment of Robby walking past Dr. Mohan and Dr. Abbott, where Dr. Abbott was shirtless and Dr. Mohan was working on repairing, whatever you want to say, his back. And Robby's face just was precious. And then fun in like a sick and twisted way, we also had the moments with Langdon up on the helipad where the helicopter lands. We had the moments where Langdon is like tripping over his words or second guessing himself. And it was interesting in multiple ways because Robby at first seemed angry and upset. And then he also kind of switched back into educator mode, which I don't think he's necessarily had to be for Langdon in a while. And I know it came down to the fact of Robby saying, I don't know if I want you in my ER anymore. You know, we talked about how Mel got to hear one of the most validating and inspiring things when she heard from Robby, you are one of the best. And that moment with Langdon was the opposite. I don't know if I want you in my ER anymore. What a rejection. What, like, oh my God, pain. Just literal pain. I'm very worried about Dr. Mohan's patient that left, that snuck out. And of course, there was the sexual assault patient and Dana and Emma helping her. And seeing Dana almost cry, I'm not like, stop, I can't handle it. Dana is the matriarch. She is everything in the sense of she's the mom, she's the sister, she's the lover, she's management, and yet also willing to do anything. She literally has taken the punches. And to see her start to break down, she's had a really rough day. You know, the episode before, her and Emma cleaned Louis. And that is such a moment of love, respect, honor. And I feel so deeply for her for the day she's had. And I won't lie. I'm not saying I was wrong earlier, but I do see how Dr. Al is better than she came across in the first few episodes. I think she's showing a lot more empathy and understanding than she initially did. And to me, that's one of the most important things you can project as a doctor, that you can show is compassion and empathy and understanding. It's good to see her do those things. And of course, we saw her lock herself in the bathroom, and I don't know if I'm going to assume she was triggered by something. Either the essay or the mental health issues with the patient Jackson and talking to his family about it. I do not like that the CEO kind of threw her under the bus, but we also don't yet know what happened. It feels like Robby is getting pushed out, and I don't like it. I don't like it. Now, real quick before we get started, because I personally am ready to jump into this episode, take a moment, hit the little like button, subscribe if you haven't already, and maybe when you subscribe, hit the little notification bell so you also get alerts for when new reactions to The Pit, other TV shows, movies, music will be posted. Oh, also, there is a new little thing. It's not that new, but it's still relatively new. A new little thing YouTube is doing, and that is if you are on mobile, you have the option to hype this video. As we know, the YouTube algorithm is constantly growing, changing, and going through ebbs and flows. Right now, hitting hype can make, apparently, the largest difference. I would really appreciate any of that, but if you are on mobile and you want to hype me up a little bit, I would really appreciate it. So let's go ahead and get started on The Pit, Season 2, Episode 8.
Next time, maybe inform the department chair before the shit hits the fan.
I was
Yeah, a
on my
little
way to
bit.
tell you.
Make sure you get everything you need.
Okay, let's do this.
IT called me up because I've trained in cyber attack prevention and response.
You can tell
Okay.
everybody what to do.
No, thank you. Best if it comes from the department
Oh,
chair.
you think?
He's so sensitive. Like, I get it, but also he's so sensitive.
Okay, everybody settle down, listen up. As you can see, we're doing a little redecorating in the central work area. Our hospital computers are at risk for a cyber attack, so we are going old school, analog.
Could be up to 24 hours.
Jeez.
So, first order of business, we need to replicate the electronic patient boards on these dry erase boards, so please, somebody tell me they got a photo of the boards.
Yeah, right
Whitaker.
It's a little blurry.
Not more than a little.
Sorry.
Yeah.
I remember.
Great, if everybody else can remember their patient names and their room numbers, that would be
No,
awesome.
I mean,
No.
I can remember all of it.
Yep.
All of what?
Names, doctors, room numbers.
I knew it.
I kind of have a photographic memory.
Yes, Joy.
Central 12, Harlogram, headache, abdominal pain, ASL only. Central 10, Jackson Davis, new onset psychosis, Stravae, psych admission.
Nurses need to convert to a zone defense, north, central, south, trauma.
Where's Dana?
In with a sexual assault case. She can't leave until the exam is finished.
Yeah, it can be a while.
Princess has charge nurse experience.
Not really.
Great idea. Princess it is. You can make the nursing assignment.
How many hours a day are you on your laptop?
At least 8 hours. I work
Okay.
from home.
And are you at a desk all day? So you're always looking down at the screen.
Yeah?
Yeah.
Okay, I'm going to check the muscles in your neck.
Ooh. Yeah. I just know mine are constantly, like, aggravated.
Oh, that hurts.
All right, well, I think we can help.
I know Santos gets a lot of flack, and I've partaken in some of that this season because she's annoyed me. But I appreciate that right then, when she had an interpreter, she spoke directly to the patient. It's so important. It's so easy, and it's so important. She has people problems, but it's less with patients and more with the people she works with. And, like, that sucks. But also, if you're going to have a problem with someone, it's much better to have problems with your coworkers versus the patients. So I just wanted to point that out before we get too far into the episode, how much I appreciate that she is talking directly to the deaf patient and not the interpreter. She does well with these things. Someday, she will be an amazing doctor.
Listen up, everybody. This is our chart rack. So as you can see, each slot and clipboard has a room number on it. When you pick up a new patient, you grab a fresh chart from the T system.
Pick your chart by chief complaint.
Ooh.
Use the cartoon to find it.
Why are there two bodies?
Trauma on the left, medical on the right. So head injury, you go left. Headache, go right.
There's fish swimming in seaweed?
No, that is bees and grass. It's a section for insect bites, skin rash, allergies.
Okay, let's.
Right, questions. Is your generative AI program still going to be working?
No.
Not for a while. And
Abbott's face.
PTMC emergency? Go ahead, Medicoman.
That is how we will hear about incoming runs.
Thanks. 2 minutes out with abdominal pain and fever.
Okay, has everybody got that so far?
How do we write orders?
Physician order form in triplicate, labs, x-rays, IV fluid, medication.
Will the lab still be able to run blood tests? And
yes.
Are the CT
Okay.
scanners still working?
Yes, but the results will come back on paper from the radiologist.
This is the Dark Ages.
So if you have orders with labs or x-rays, they go into the clerk file here. They will sign them off. They will add a downtime slip on them and make sure they go to the correct department.
I'm sorry, who are the clerks?
You're looking at
Service.
Larry and Antoine are filling in until more help arrives.
Got this.
You got it.
Medications are locked up in the PDS.
The PDS is getting unlocked by a clinical pharmacist, Dr. Megan Nord.
We've got your back.
This is a lot. Any questions?
Yay. Oh, no, she was just saying
What's up with
hi.
the third rack? When your patient is ready to be discharged, chart goes here. This lets everybody know we're about to have an open bed.
Ooh, printer.
What is that?
A fax
That
machine.
is a fax machine.
They still make those?
This is our lifeline to labs and x-rays.
Perfect.
Come in.
Okay, Dr. McKay, Dr. Whitaker, Ogilvy with me.
Yeah.
The rest of you, build your clipboards.
Howard Knox, 52, abdominal pain and fever, 152 over 90, tachy at 120. Couldn't get an IV.
Wonder why.
Orders for Mylanta and bupivacaine Central 12.
Wrong spot, Dr. Santos. And you need a sticker.
She's gonna get so annoyed so quickly.
This is how we rolled when I was a resident.
Was that in the 1900s?
Yeah, when charts were written by candlelight.
Hey, today will be an adventure. Think of it like Back to the Future.
Ooh,
Or possibly Titanic.
Mohan.
And I marked the trigger point that is bringing out your headache, and a shot of local anesthetic in that area could really help.
That would be great.
Yeah, let's do it.
Great.
Is that gonna impact her ability to use her hands, though? Oh,
Ow,
yep.
Ow, that
Yep.
really hurts.
When did the pain start?
It's been on and off for about a week.
And where do you feel it?
All over. It started on the left, and now there's some on the right.
How about that fever?
Since last night, I was burning up, and then I had chills pretty bad.
Can't find a vein here.
We'll try for midline.
Let us know if this hurts.
Sorry.
And on this side?
Yeah.
Sorry.
Guarding with no rigidity for pain 100 of fent-IM. Plan Dr. Whitaker.
Blood cultures, lactate, Zosyn. We're gonna need a CT to figure out what's going on.
Force a habit.
Right neatly, Penman chip counts.
Howard, for the scan, we're gonna have to lay you flat on your back. Can you do that?
I could 10 years ago, but now it's too hard to breathe.
If we can't lay you flat,
Okay.
then we're gonna have to put a tube in your windpipe to help you breathe. Are you okay with that?
Intubation with rapid sequence induction.
No, we can't lay him down.
No, the tube will go in your nose while you're awake, sir. Do you happen to know your weight?
A little over 400.
Well, when was the last time you checked?
It's been a while.
Is it possible that you might be over 450?
Possibly.
Okay.
Perla, let's call for the Hoyer. So we're gonna place the tube and get you ready for the scan.
Yeah,
Is this something serious?
it
Hard
can
to tell
be.
without a CT.
You could just need antibiotics, or you could require an operation.
If surgery is necessary, then your weight could make things a little bit more complicated.
I know, I'm sorry.
Not to worry, we're gonna take
No.
very good care of you. Team,
Thank you, Robby.
let's try for a midline. So then with ultrasound guidance.
An ultrasound,
Okay.
check for an
He's
appy.
a little too large for ultrasound. Plus, our CT can only handle 450 pounds.
And so if he's over that, we send him to the zoo?
He's right there.
Yeah.
I heard that there's a large animal CT at the zoo.
Presby CT can handle 650.
Yeah, if Presby's still up and running.
What?
That's not a jinx. It's
Have any of you ever done an awake nasal tracheal?
Oh, all
Perla,
right.
can you also ask Dr. Alshimi to come in? I'm gonna need an assist.
Yep, you got it.
sorry, signed.
Parents of Roxy Hamlin.
Central 9.
Oh, I got it, Donnie. Hi, I'm Victoria Giavatti, one of the student doctors here. I've been assisting with Roxy's care.
Oh, thank you so much. I'm Lloyd.
Oh, he looks
Cora,
familiar.
Nice to meet you. She broke her leg, but I'll take you. She's just in 9.
That actor looks really familiar.
How are you, honey?
You've got this, kiddo.
That's hard.
How long will she stay in the ER?
Oh,
Until they get
the
a
bed opens
bed.
up upstairs. Could be a while.
Yeah, a couple days. Realistically, I don't know if
It's
she has
getting
to
pretty
move to
crowded in here. Maybe we
oncology.
should take Tucker and Shane out for ice cream.
Yes, please.
No, I'm okay.
He wants to stay with his mom.
Go.
Can she have ice cream?
She can have anything she wants.
Come on, let's go.
Wow.
Oh, it's pretty.
Oh, that look. She is obviously a grown adult with children of her own. But for any parent to lose their child or be in the process of losing their child is horrible and horrific And that actress, in one look, said so much.
What medication do you take?
Lisinopril and metformin.
Okay.
Ozempic, Wegovy.
I need someone to stop him.
Put some numbing gel in your nose. If it drips back in your throat, that's okay.
He's going to make me punch my screen.
Do you smoke? Alcohol?
Never.
Do you exercise?
Moving from the bedroom to the kitchen. No, I'd walk more, but I need a bench to rest on every block.
What about
That's
water
okay.
aerobics?
Let's focus on helping Mr. Knox.
Yes, please.
I can see a little bit of light.
Okay.
Brooke, you've met Dr. King. This is Dr. Al-Hashimi.
Nice to meet you.
And her wife, Wendy.
Hello. Hello.
Okay, if we...
Nice to meet you.
As long as I can correct you if you get anything wrong.
Trust me, she will. 1 hour of sudden painless vision loss in the left eye. No history of hypercoagulable state or vascular disease. Please.
Could be a central retinal artery occlusion.
In English, please?
A little blood clot can block the artery at the back of the eye and decrease your vision.
Sometimes
Okay.
it's called an eye stroke.
Stroke? Like she could be paralyzed?
Yeah,
No, this
no,
would be
no, no.
limited to the eye.
Is it permanent?
First, we have to make the diagnosis.
Mm-hmm.
You seem a little confused.
How do I figure out which new patient to pick up?
Top of the board, they're listed in the order they arrive. You erase the first one and put your initials in the MD box.
Okay, thanks.
Caleb, Michael, you
Chaos.
managing this chaos okay?
Oh, it's all pretty easy when you're a short timer.
Any more comatose patients for me to have a chat with? I'm kidding.
Okay.
Victoria, this is Nicole Stedman.
I run the parent support group for the psychiatric service.
Yeah. Nicole's daughter was diagnosed sophomore year in college. You think Jackson's parents might have a chat with her?
Yeah, we can certainly ask.
Be worth a shot.
You're looking in the wrong eye.
We start with a good eye for comparison.
Which makes sense.
Now for the bad eye?
Eyes wide open.
Come in.
Hi. Heard your patient took off.
She's taking a little break.
How long are you gonna wait? You know about the cyber shutdown thing?
Yeah.
No.
Wish I could help, but I'm gonna stay here till all the evidence is collected, so.
It's a hot mess out there.
This whole day is.
Yeah.
Sorry, I was just leaving.
You okay?
Good. Good.
Glad to
Keep
hear it.
going.
Did you get something to eat?
No.
Let's keep going.
Thank you.
Okay. Yeah.
Gonna do my best not to cry, guys, but I can't promise anything. You got this.
Why don't we keep one in the ER?
Because our intubated patients are usually sedated.
Right.
Maybe you could ease up with your comments about his weight.
Yes, thank you.
I was just wondering how he got so big and how we could help.
It's
We
not
can
the
help by
time.
finding out what's wrong with him and treating him with respect.
How's your belly now? Second pain shot helped.
I appreciate that they had Dr. McKay say that because in the first season, there was the question of if she was being fat phobic to the postpartum mom and whether she was at that time and she's learned from it or she wasn't in the first place and Dr. Mohan was out of line. I don't really care. What I care about is that she just checked him. She took on a seniority or leadership role, whatever you want to say, and she checked him. This is not the time nor the place to discuss his weight beyond what you need to know how to treat him. And the fact is that, for the most part, our medical industry is incredibly and inherently fat phobic, and it's disgusting. And so they need to check him now and frequently on this. We do not need more fat phobic doctors. I'm just really appreciative that they took that opportunity and that moment to show a little bit of growth for Dr. McKay. Like I said, whether she was fat phobic last season or not, it's a good thing that they had her do it.
Once the tube's through your vocal cords, you won't be able to talk. But this is a communication device. Swipe through the screen for anything you want to say. Hit the icon, and it talks to us.
Ooh.
I would like some pain medicine. My pain is a 9.
There we
Get a
go.
quarter of pizza?
There is cell service in the ambulance bay. I found his sister's new number, left a voicemail.
Robby, over here.
We gotta head back. Thinking it's surgical?
Hoping for a non-perfectapy.
Can you do it with a scope?
Possibly, but he could be treated with antibiotics alone.
If he needs surgery,
With his size, an emergency open laparotomy death rate's close to 50%.
Okay, one step at a time. Let's keep trying his sister every 15 minutes. She'll get it.
Half the downtime slips are blank.
What are you talking about?
Here and here.
Larry, are you using a felt tip pen?
Maybe.
No.
It's not going through for the copies.
Oh, you have to use
Ballpoint pen only.
carbon copies. Oh my gosh. I feel like this needs to be a part of regular training because we are now getting to a point where, mind you, I'm 35. I'm not that old. But we are getting to a point where people don't know what carbon copies are anymore. And no. You need to use a regular ballpoint pen. I'm sorry. Oh my god, poor princess. Oh, poor princess. Okay.
What do you need?
An attending?
Or a senior resident?
No, I'm good.
No.
Dr. Alashimi, can I present?
She's just gonna continue to give him the cold shoulder.
Nice job on the trigger point.
Yeah, I know.
Princess, bump Central 13 to the front of the CT line.
What do you got?
Sudden onset blindness patient has central retinal artery occlusion.
Oh,
I just spoke to an
no.
ophthalmologist at the VA.
Not exactly standard of care, kind of risky.
We'll do informed consent. It's our best shot at saving some of her vision.
Your patient, your call. I'm not gonna be around long enough for any complications.
I'll be taking 2 swabs from the vagina, 2 swabs from the cervix. How you doing, Alana?
Hanging in there.
Proud of you. Both of you.
Are we done?
One
Almost.
last thing. 4 more swabs inside your mouth.
Didn't you do that already?
Next one's different. Inside your cheek for your DNA. Not for his.
So
Okay.
it could be bipolar or schizophrenia.
Those are the 2 most likely possibilities.
How do they know which it is? Is there a blood test or a brain scan that'll tell us for sure?
Unfortunately not.
When properly medicated, people with bipolar disorder can have successful careers.
Yeah.
So we hope for bipolar.
You can hope for your son's happiness.
This is a new version of Jackson.
How old was your daughter?
20, studying architecture at Georgetown. Schizophrenia.
I'm sorry.
She's good.
It's okay.
Living at home, working as a cashier at Giant Eagle.
But she's
Employee
okay.
of the month. We still have struggles. But there's also laughter and love.
Yes. Focus on the fact that your child is there and alive. You can love them and support them.
Dude, no pain, just weird.
Okay, the next step is we're gonna take this tube and pass it through your nose, stopping at the back of your tongue. Best not to talk for that. Oh.
Tube soaking in warm water to make it more flexible.
Do you want to try it?
What day and time is it?
4th of July, 2:31 p.m.
When is my tube coming out?
You know, we have to put it in first.
I know, just practicing.
Sounds like you're an expert already.
ACAs are amazing.
I just want to say thank you for everything.
Hmm.
You're very welcome.
This must be so scary for him.
Here we go.
STI prevention. 1 shot treats gonorrhea, then pills for chlamydia and trichomonas.
Thank you.
We also have morning and after contraception.
She has an IUD.
Over 99% effective, not 100.
Take it.
I'll pass.
For HIV, we got PEP, post-exposure prophylaxis. 28 days, the sooner you start, the more effective.
It's important.
Pretty sure they could use an extra set of hands out there.
It's nice to meet you, Alana. You're a very brave woman.
Yeah.
She's a good nurse.
She's still learning, but she will be.
Yay.
After this, we're done.
Thank you.
I'm glad you were here today.
Yeah.
Me too.
Oh, Dana.
Studies have shown that some vision can be restored with a clot-busting medication.
So get it.
But
No.
there are possible risks.
Hold on.
2% of patients who receive the medication get worse, and 1% have severe disability or death.
Heavy.
Honey, this one has to be your call.
No, it's our call. What would you do without me?
Figure out how to get by. And I'd probably cry for 2 years solid.
Yeah.
2 years, that's all. I want the medication.
Does she need to go on like any blood thinners or anything?
Jackie Liddell.
Jackie Liddell.
And you are?
Her friend Jackie.
You have the same name?
No, she's Jackie with the CK. I'm Jackie with the Q.
Cute. Oh.
I bit off half my tongue. What? She said I bit off half my tongue.
You can understand that?
Oh, you should hear her when she's had 2 pictures of margaritas fucked up and slurring.
Princess, what's open?
I can jump on this. Robby and Alice Shimmer are both with critical patients. Hello. I'm Dr. Langdon. I'll be supervising your care.
Jesus, CK, your doctor's fucking
Yeah.
Okay, Howard, I'm going to start. If you want me to stop, you just put your hand up, okay?
So
Looks
cool.
like you cleared it. If he inhales, we should see cords.
Okay, deep breath for me, Howard.
Oh, I started to do a deep breath. It's not helpful.
Hey, how you doing, Howard?
Once the tube's in, you'll have to breathe through your nose.
Ogilvy?
There. Right and left mainstem.
And the tube slides in?
I'm just mesmerized. I know I need to be talking more, but I'm just
And
mesmerized.
Comes out.
No, thank you. Seems like a more dramatic version of flu and COVID testing.
Okay, that went really well, Howard. Now we're going to check your weight.
Okay.
So the nurse examiner is supposed to lock up the rape kit in this fridge where it stays until it gets turned over to law enforcement. It's called preserving the chain of evidence. Are you fucking kidding me?
Is there a problem?
Valid.
Jesus Christ. Police are supposed to pick up the rape kits within 72 hours. This one I did 2 weeks ago. God damn it.
Okay, topical epi did the trick. No more bleeding.
Good.
I can go home now?
No.
We need to put in some stitches.
I don't want stitches.
Listen to the doctor.
Don't tell me what to do. This is all your fault.
No, it's not.
Yes, it is. Princess?
It's Princess. Hey, why don't you show Q where she can wait while we patch up her friend?
Of course.
Good idea.
Okay, this is a numbing shot for the tip.
Oh, I don't really want to see that. It's so odd to me what upsets my brain and what doesn't.
When I found about the blood clot in my leg, I just kept thinking it's gonna go to my lung and kill me.
We've talked before about how the Eliquis would prevent that.
I know.
I'm worried that it won't.
Well, I finally took your advice. I got out of the house. And, I joined the Frick Park Lawn Bowling Club.
Oh, yay.
Wonderful.
He's lonely.
You're right, you know. We all need a community.
You're just gonna feel some pulling, okay?
I guess so.
Oh, right.
Go for it.
She's probably drunk.
As soon as I cut the needle, you're on traction, Joy.
Very disturbing for some reason to me.
That is pretty deep.
And now we can warm up the cut. It's best to start with.
Proximal side first so she doesn't feel the distal injection.
Yep.
Give it 10 minutes. I'll be back for the repair.
Joy's like, there's issues here that I am not aware of.
I got a rape kit sitting here for 2 weeks that was supposed to be picked up within 72 hours. I don't care. Get someone over here now. No. You expect us to treat your officers as soon as they come in? You get a detective to pick these kits up ASAP. I gotta go.
Dana, South 19 got their head CT before he went down. No results yet.
God, oh,
Dana, hang on.
I don't know how to describe it, but the strength that Dana has to be so mad, understandably, and then switch to talking to Princess or all of that. Just the fact that she hasn't actually lost her cool is amazing. And she also appears to be triggered. So, like, oh, God. I love Dana so much.
How's your day going?
I think I'm getting writer's cramp.
You at the big guy?
Valid.
Yeah, it's sad. Bad car accident, multiple operations, tons of stress. How's your first shift back going?
One day at a time.
Yeah.
First year sober is the hardest.
That's what they keep telling me.
I'm 9 years and counting. If you need anything, call me.
Thanks.
I thought that. I couldn't remember if that was true from last season, but I really appreciate that moment.
Where are you going?
Blisters in North 3.
That's where I'm going.
Did you sign up for the patient?
I pulled the chart from the rack.
You're supposed to sign up on the dry erase board.
You're supposed to have a clipboard for the patient.
I thought the nurse had that.
Well,
Hi,
you can't
I'm student
both
Dr.
go.
Ogilvy, and this is, wow, that is some rap.
Yeah, tell me about it.
Student Dr. Javadi, when did this start?
Last night.
And have you been on any hikes recently around?
I don't think they should both be on it.
Medications, lotions, soaps, detergents even?
That
I don't take medicine, nothing new with all
doesn't
that other stuff.
look like just a rash.
What is it?
Not sure yet. Be back in a second.
Yeah. Frustration.
What are you thinking?
I have no idea.
Agreed.
Yep.
Bella's pemphigoid, autoimmune severe pruritus.
They're both so smart and know so much, but
We need to check for pustules, mucous membrane involvement.
And the Nikolsky sign.
they're both so smart. They both know so much. And for them to both to be without an idea is an interesting state of being. Also, that looked gnarly. That looked like something from Fringe. That did not look normal. And I really hope that it's not something super bad or scary. Okay.
It's time for the next neuro check.
Excuse me, Dr. King, do you have a minute? No, I'm observing a patient right now. 60 seconds tops.
Okay.
I'll check pupils.
What's
Go
going
good
on?
here.
What's going on with the two of them? Maybe they were both on the case?
I just finished my deposition.
Oh, should I go up now?
Yeah, just wait until you get a call.
Well, I'd ask how it went, but we're not supposed to discuss the case.
This isn't a discussion. It's a monologue, so shut up and listen. The malpractice case is frivolous. The mother of the measles kid claims we caused intellectual decline by performing a spinal tap.
Oh, that's the case this is about?
Her son presented with altered mental status due to low oxygen from measles pneumonia. Any change in intellect was due to hypoxic brain injury. It had nothing to do with your spinal tap. End of monologue. We never discussed the case. I gotta get some sleep.
Thanks. I guess.
I don't know how I feel about that. I understand she's trying to be helpful, but I feel like that may have actually fucked up Mel more. I don't know. She was probably trying to just be helpful, but I'm concerned that that messed Mel up more. I don't know what to think about that.
Okay, are you ready to lay down?
I got your head.
Nice and slow. 1, 2, 3.
Lifting up now.
And then I'll do it right about there.
So you can stop it? Okay.
215? That's in kilos.
Okay.
Okay, team.
Can the medics take him while he's intubated?
If I go along for the ride, I could still get a nap in before my night shift.
No, I don't want you to go anywhere, though.
474.
Our CT can't handle your weight, but we're going to take you over to Presbyterian Hospital.
Road trip.
I'll keep you company the whole time.
Sorry for all this trouble.
No.
It's okay. This is what we do.
I hate that we live in a world where he's apologizing.
So sub-Q starts deep. You want to bury the knot.
Yeah, I've done these before. This girl is wasted. Drunk as a skunk. Should we check a blood alcohol level?
No, it won't change what we do. She can go home when she has a steady gait.
I already sent one off. Joy,
Okay.
do you want to guess her blood alcohol? Why would I want to do that?
Yeah.
I don't know, because it's fun.
I don't like a lot of this.
When will you have a bed?
I'm not sure she needs a bed.
She's a febrile infant.
Who is clearly over a month old and looks amazing. Every marker is normal. She has the cold virus. I can't put a kid with a virus in the nursery, and I can't waste the private room on a healthy baby.
Then what do you propose?
CYF can place her in emergency foster care by tomorrow morning.
You want to leave her down here overnight?
Seems to be the standard care these days.
Have your attending give me a call.
Will do.
I can't believe this.
Let CYF know it's very urgent.
Got it.
This is turning into quite the day.
Seriously.
You know, I've been thinking about applying for a fellowship.
Oh.
Have you considered a geriatrics fellowship?
I have not.
I've seen your skills with the elderly, and there are a lot of openings. It might be your best shot.
She's amazing with the elderly.
Think about it.
Last stitch. You want me to cut?
You got it.
It looks good. Okay, let's pull the traction suture.
With pleasure. Okay, Jackie. Jackie.
Stop.
All done.
All done with what?
Sewing up your tongue.
What happened to my tongue?
Oh my God.
Bit it.
Huh. No, I didn't.
That is called a blackout. Do you usually have a couple cocktails every day?
Only on weekends.
How about during the week?
Nothing much. Just wine with dinner or a few beers.
Maybe we should recommend rehab?
Possibly.
We could try.
Ready to roll.
How you
Roll
feeling?
them out.
My pain is a 2.
We got meds if you need 'em.
Yay.
Scan will be quicker than the ride in Presby.
We'll keep trying to reach your system.
You guys are the best.
See you later.
Yeah.
Mr. Digby?
Is he okay?
Digby.
Right. You've been looking all over. Where you been?
With Louis.
You been in there for an hour?
He was my friend. I
Oh,
had a lot to say.
that's
Let's
okay.
get you back to your bed.
Louis got his wings.
Dr. Robby?
we picked up a patient together.
Teamwork.
It's a concerning bullous rash.
We might need a biopsy for pemphigus
It's
vulgare.
phytophotodermatitis. What? I asked. He was making 3 gallons of margaritas for a party, squeezing fresh limes out in the sun.
Oh, there you go.
Peek.
I don't need to see it again.
I really enjoy Joy.
Lord, you got the security pads?
Sure do. Just need a patient sticker.
Any other questions?
There you go.
Yeah. What would have happened if you weren't here today?
Chaos.
You'll be curled up in the fetal position, crying like babies.
Yep.
What is it? Phytophotodermatitis.
Otherwise known as margarita burn.
For some people, limes plus sunshine can cause a horrible rash. Hey, Robby?
Yep.
My hospice patient Roxy's still in a ton of pain.
Where are we with the morphine?
10 milligrams an hour.
Okay, you can bolus another 2 and go up to 12. I will let Princess know.
12 an hour is a lot.
Yeah, on top of the MS cotton, she could stop breathing.
Are you familiar with the doctrine of double effect?
Not really.
It is an ethical principle in palliative care. We treat pain. And if in doing so there's a negative side effect, we accept it.
Even if the negative side effect is death.
In some cases, that could be the best outcome.
There are worse things than death.
No, there is enough paper.
Chaos.
How are we going to get through this mess?
I was about to ask you.
No. I don't actually know where to begin. I'm sad that Dr. Abbott had to go with that patient. I know we'll probably get him towards the end of the season again, but I'm like, my dude, don't leave yet. I have kind of gone back and forth a little bit on Ogilvy because I don't like him. I haven't liked him. And I also understand a lot of what he's doing and what he's saying. Like, I get it. But for him to be that openly fat phobic in front of the patient was disgusting. And I feel like this was a really heavy episode, along with last episode, but this one, a very trigger heavy episode for a lot of people. And I don't really know how to like whittle that down. I'm very thankful that the sexual assault survivor came back. I would like to know what was said between her and Emma I want to know what Emma did to help her, or if she just helped by just being there. Because when things are really, really hard, sometimes that's just what you need, is to not be alone. I'm angry that that patient kept apologizing, and I'm not angry at the patient. I can't remember his name, the one they had to take to Presbyterian. But I am angry that we are in a world where people need to feel the need, where people need to, because that's what our society tells, to apologize for his body. Fat phobia and ableism and racism are all tied into one little ball, and they're all disgusting. There's so much that happened this episode, and I don't know, I think this is one where I'm gonna walk away and have thoughts over the next couple days. Because, like, last episode was so light and funny for me. Like, obviously, there was serious stuff happening, there was horrible stuff happening, but the tone of the episode was just much more lighthearted. Maybe it was giving us a break after Louie's death, but it feels like Dana and Robby standing there at the end in the middle of all that chaos and overwhelm is kind of like, steady yourself because it's just beginning. That's how it felt. And I don't know how to feel about a doctor whose name I can't remember, but she is night shift and incredibly attractive. I don't know how I feel about her having a monologue. I don't know how I feel about her monologuing. I don't know if that helped or hurt Mel, but I don't. Maybe I'm too much of a rule follower, but I would not want her to have done that to or for me at all. I don't know. I guess I feel kind of apprehensive about the next episode now. Joy having a photographic memory. Joy being able to spot what the rash actually was. Joy is a joy. Please tell me she's going to be on for the rest of this season and for next season, because I adore her. I mean, I know we're only getting 2 this season of the new med students. Are they? Well, they're doctors in training. But she is by far my favorite. And, like, if she sticks around, she could easily jump up in terms of favorites for me. I felt so bad for Princess, and I feel like the minute she saw Dana, she was like, Mom! Not literally, but, relief, help. I need an adult. You're adult. I'm annoyed at Santos. I understand why she's treating Langdon the way she is, but I need her to just pull it back a little bit. You don't have to want to work with him, but in that one episode, he gave olive branch after olive branch, and she is acting as cold and bitter as Robby. And I'm sorry, she doesn't deserve to act that way towards him. Robby was betrayed. Robby dealt with loss and having to deal with the fact that Langdon lied to him over and over and over again. I guess I just am silly, but I expected more from her. I did not like Langdon season 1. I just didn't. In this episode or this season, I can feel how much he's trying, which is a testament to the actor. But I feel so bad for him. And I feel so bad for Robby. There's just so much in that episode. I think we're going to wrap it up there, and I'm going to let my brain kind of percolate on that episode because there was so much, so much. If you enjoyed our time together today, please take a moment, hit like, subscribe if you aren't already. Go ahead, hit that little notification bell. Make sure you get all of the notifications, all of them, for when new reactions for The Pitt, other movies, TV shows, and music get posted. I would love to hear your thoughts about the episode in the comments. Let's talk about some of these characters. Let's talk about some of these cases. And we can, as always, talk about Louie. And I will see you next time for The Pitt. Season 2, Episode 9, 3 p.m. Day is just flying by. They call me Sour, and I hope you have a wonderful day. Super duper side note. I don't actually remember if this happened this episode or last episode, so I apologize if I'm talking about it in the wrong episode. But I talked about how it seemed like Dr. Al was jealous of Dr. Abbott and Dr. Robby. And then, of course, I was quickly corrected on that. And she was just excited to see someone who had been through similar things to her. But it cracked me up when Abbott complimented her or said she seemed fun or she seemed nice. I can't remember exactly. And Robby just was like, yeah, she's fine. Like, it's so, oh God, I love them all so much. I love them all so much. So, okay. Doodles. Bye.